This is Dr. Ben Weitz with the Rational Wellness Podcast, bringing you the cutting edge information on health and nutrition from the latest scientific research and by interviewing the top experts in the field. Please subscribe to the Rational Wellness Podcast on iTunes and YouTube, and sign up for my free ebook on my website by going to drweitz.com. Let's get started on your road to better health. Hey, Rational Wellness Podcasters. Thank you so much for joining me again today. We have a very interesting topic. Normally, we talk a lot about nutrition and functional medicine, and today we're going to talk about posture, and it's more of a chiropractically oriented discussion. But posture is just as important for your overall health and part of your anti-aging strategy as eating right and exercise and sleep and everything else. And our guest today is Dr. Stephen Weiniger. He's an internationally known posture expert. He's trained thousands and thousands of patients and other doctors on improving their posture. His professional program is known as the Certified Posture Exercise Professional Program. He's the creator of the Posture Zone, the free posture assessment app. And his latest book is Stand Taller, Live Longer, an Anti-Aging Strategy. Steve, thank you so much for joining me today.
Ben, thank you for having me.
So how'd you get so interested in posture? How did that become a focal point for you?
Well, I'll tell you, you said at the beginning that this is a chiropractic oriented, and you're right that that's where we started from, but posture is very much health for everybody. The way that I got started was as a chiropractor. People came to me with problems, neck pain, back pain, and we got them better, but a lot of times their problems came back. And I worked on them again, and I got them better, and their problem came back. And this is a common plaintiff of a lot of chiropractors. And I started getting into, kind of at the same time, both yoga personally, because I had some significant flexibility issues and some issues with my posture, my body, as well as the work of Vladimir Janda, who was the originator of what's been called the Prague School of Rehab. And I spent time in the Czech Republic with Vlad when he was alive. And we observed that there's ways to train bodies to move differently, but if you don't train a body to move differently, it's going to start to move the way you're training it to move. And that was one of Yanda's big insights, and the effect of that on a more detailed scientific perspective with things like what's called upper crust and lower crust syndromes, which are common posture observations within both the chiropractic and the therapy worlds, that there wasn't a systematic way to address a patient. And so we started working on melding the work of yoga and Patanjali and some other people in the posture world like Pilates and Alexander and Feldenkrais into something that was more systematic for a clinical protocol. And it's expanded. And we started out having a practice that we were seeing patients, and then doctors started to come because they were hearing what we're doing. And then we started teaching seminars to other professionals, and they want the tools. So we developed other tools and other things to help promote the idea that posture is important, and you can do something about your posture to strengthen your posture.
Yeah, I know on a daily basis, I get patients come into my office with neck pain or back pain, and they say, how did this start? I didn't do anything. I didn't strain myself. I didn't lift anything. And a lot of times the common factor is they've been sitting with lousy posture for hours at a time, slumped, rounded shoulder, forwards head, all these different postural floras. Maybe they're sitting twisted, typing into a keyboard with a monitor off to the side. And so, I've come to understand the importance of posture, and trying to retrain my patients into using better posture. And you've got a really detailed system for helping to do that.
Well, we do, and part of it is changing the perspective of what posture is, because the word that you use kind of says it all. People that have lousy posture is putting it into a box where you're almost making a pathology of it. And it's not a pathology. If you train your body to do stupid things, your body's going to get really good at doing stupid things. And when you're focused on your phone or your keyboard, and you're disconnecting from an awareness of your body, you become disconnected from it. So changes happen that I don't have to stop. I'm a little bit tight. I can keep on going. And your body gets better and better at moving in those adaptive ways. And I'm not saying that we should all get rid of our phones and go back to living a simple life, because that means you're out in the fields hoeing things or running around chasing bison, which is not the life that I see myself leading. But if you're going to spend a big chunk of your time doing what we do, being more aware of your body so that you can do it with a less mechanically stressed posture, and doing things to turn your body back the other way, that it's not a matter of just getting rid of the pain. It's a matter of how can I strengthen my posture? Because it's not a good or bad. If I told you your posture is bad, you say, oh yeah, I know that's the way that I am. And a lot of your patients, I'm sure have said that.
Right.
But if you tell them your posture's weak, then that opens a little question in your mind of, well, in that case, what do I need to do? How do I strengthen it? And that's what we teach doctors to do with patients.
Right. Well, really, isn't it about how efficiently we resist the forces of gravity? Because gravity all day long is pushing down on us. And if we're not properly balanced, then we're not going to efficiently resist gravity. And there's going to be abnormal stresses on our muscles, our ligaments, our joints.
Almost right. You said abnormal stresses. Those are, if you hold your body in an asymmetric position, it's normal to have those mechanical stresses occurring in that asymmetry. That's going to normally result in asymmetric forces, that's going to make wear and tear, that's going to make calcium deposits, that's going to make stretching occur, that makes that the easier, mechanically speaking, posture to hold, because all of the things being equal, symmetry changes when you keep on molding it into an asymmetric position. So somebody that has a marked forward head posture and kyphosis, that if they're laying on their back, their head is extended 30 degrees on a flat surface.
Right.
Saying you must stand with your head on top of your shoulders. For that person's architecture, that's not their normal, because they've worked hard, not intentionally, but they've worked hard to change their posture. One of the book that I wrote for the public, and that a lot of professionals use, a lot of CPEPs use to teach their patients in posture programs, is based on 5 principles of posture, 5 concepts. And the second posture principle is balance. Your posture is how you balance your body. No matter how, if I'm standing all horribly postured, bent forward, but I'm standing, the question that we ask people is my posture balanced if I'm like this? Is it balanced?
No, it looks like you're going to fall over to your left.
On an overall mechanical basis, is it balanced?
Well, I guess you could say because you're standing, it must be.
That's not, you could say, in objective reality, in rationalist, in looking at things from a rational, empirical basis, if you are vertical, it is balanced.
But you're not necessarily loading your joints on both sides equally.
That's the point. It's not symmetric, it's not efficient, it's not good long term, but on an overall biomechanic basis, it is balanced. If it weren't balanced, it would fall down. The principle is your posture is how you balance. And that pattern of muscle asymmetry on multiple layers of functional compensation and structural adaptation is precisely what you want to be observing, looking at, and working with to address and to strengthen posture.
Why don't we start by talking about one of the most common postural flaws, certainly that I see in my practice, which is the forwards head posture. And that's the one where the person's head is jutting forwards, and that's usually a result of sitting and looking at their laptop or their iPad, or just using poor posture at their desk, writing. And what are some of the long-term consequences that can occur from forwards head posture? And then what are some of the strategies that we can utilize to reverse it?
I'm going to flip back. I'll answer that question, but let me change the perspective just a little bit. If your posture is how you balance your whole body and your head is going forward, even though you're not thinking about it, something else is subtly going backwards, or some things are going backwards, or there's some other zigzag occurring.
Sure.
Your posture is a whole body phenomenon. And agreed, the habit pattern of working on a computer, close quarters, texting, where you're looking down instead of up, strategies for addressing texting, instead of dropping your head down to your device, lifting your device up, to be looking more at it, and that's part of being conscious of it. The challenge becomes, if you only work on the top, then you're making different compensations occur lower down the chain.
Now that's while you're standing, but how about when you're sitting?
When you're sitting, you're still balancing. And the muscle patterns of asymmetry, that from standing to sitting, they're not exactly the same, but if you don't retrain one, the one that's been longer standing is going to keep on being a bias towards the one you are trying to retrain. And since humans are made to move from a dynamic point of view, and it's one of the things that Yanda talked about, with the upper cross, lower cross being the most common postural syndromes, the force propagation is bottom to the top because you're balancing on the feet. And just like if you had a stack of kitty blocks, I don't know if you have kids, but when my kids were little, the game was how high can you get the stack?
Yeah.
And if it was wobbly at the top, you didn't fix the one on top. You got to go down to the bottom, get a stable base, and work your way up. So in terms of awareness, forward head posture, pulling your head back makes sense. The problem that many people are going to have is because they've trained that forward head posture, some muscles have gotten too long and some muscles have gotten too short. And that asymmetry in a front to back direction is what sets up a lot of the health consequences. Probably the most, excuse me.
Yeah, you're going to talk about some of the health consequences of having forward head posture.
Common everyday health consequence are headaches. And when your head goes forward, just going straight forward, your head's going to have to tilt down unless you lift it up again. And when you lift it up again, the muscles at the very, very top of the spine, the suboccipital muscle between the occiput, exactly, at that last little hinge you just did, when your head jerked up, the muscles you were using, the back part of your neck, just under the occiput, from occiput to C1 to C2, those muscles are going to have to become shorter. And that chronic shortening of that group of muscles called the suboccipital muscles creates muscle tension. And a lot of people say, well, I'm just tense, that's why I've got a headache. If you're holding your head in that position, especially as you get more fatigue, those muscles have to work hard. In '97, they found out that one of those muscles, the rectus capitis posterior minor, had fibers that went between the skull and the first part of the spine and connecting onto the lining around the brain, the dura mater. And the theoretic reason for this is it pulls that lining backwards to allow for more open flow of the fluid around the brain and spinal cord, called the cerebrospinal fluid. In addition, in 2012, at Logan College of Chiropractic and St. Louis University, they found that the other muscles in that area, rectus capitis posterior, major obliquus capitis superior, and ligamentum nuchae, which are all part of the deep tissue connecting the skull and the upper cervical spine, they also have connections that travel into and between the vertebra, and that directly attach onto the lining of the dura, the meninges that contain the fluid that holds the brain and spinal cord. So when you have that constant tension, that can affect that fluid flow. And this is probably the best explanation for why when somebody has chronic headaches, they go to a chiropractor with a killer headache, they're dying, and oh man, doc, I feel wonderful, thank you. It's like you opened the valve because you literally took the pressure off the base of the brain.
Right.
But that's one of many, many things. The other, something else that Yanda talked about is it's very rare to have forward head posture existing by itself. You almost always have an upper torso compensation occurring also, where your shoulders are rolling in because your hands are rolling in, and because of it's kind of a scissoring. It's called a collapse of the kinetic box, where your head should be level and your torso should be level. When one goes forward and one goes back, you have muscles that are getting tighter and weaker at opposite sides of that box. And so basically you've got tight muscles in the suboccipital and weak muscles in the front of the neck. You've got tight muscles in the top of the chest and weak muscles in the upper back. And once that kinetic box collapses, that becomes the position of needing less energy to keep it there because of that muscular imbalance. So at that point, it's not merely a matter of stand up like this, it takes less energy. Because that person's trained their body to be differently, they can't do that. And just trying to go in that position, the response is always, that doesn't feel comfortable to me. Because in their perception, their body looks like this. But if you took a picture of it, that's not reality. And this is one reason why we highly recommend posture pictures, so that you have a benchmark of, hey, how's my posture doing? In terms of what you can do to begin awareness, take a picture, see what you look like, and try to have someone take a picture. A selfie of yourself doesn't work. Having someone do it, you can do it with with the phone that you have. The free Postures On app will let you do it, but you need someone else to help you. And when they take the picture, try to stand tall with what you feel like is, yes, I'm standing tall, which is probably better than your habit is. And that's fine, because people almost always find when there's a problem, they're blown away by when they thought they were standing tall, what the picture really says.
So after you take a picture, then what are some of the strategies that you do to try to help a client like that?
The protocols that we teach professionals and that we talked about in Stand Tall, Live Longer are called the Strong Posture Protocols. And the Strong Posture Protocols work with the three elements of posture. You talked about sitting posture versus standing posture. Posture is not just when you're static, not moving. If you're out running, you're going to have a running posture. Your running posture will have the patterns of your standing posture, your sitting posture, because your posture is not just when you're standing there statically, it's when you're moving dynamically as well. And the three elements of posture begin with what I spoke about a moment ago, balance. Your posture is how you balance your body. It's also how you're aligning your body. And you align and you move your body in patterns of motion. So you want to be addressing the three elements of balance, alignment, and motion in a posture strengthening program to connect somebody more accurately with the reality of how are they balancing, how are they aligning, and how are they moving. So in terms of a posture picture, that's a benchmark of how you're aligning. And beginning retraining your benchmark of your perception of, yes, I feel like I'm standing tall and straight. Camera says otherwise. Me just telling you to move differently, you're going to keep on coming back, well, that doesn't feel right to me. Because your body has what's called a proprioceptive system. I know you know what I'm talking about with that. And it's not something that's an intellectual and you can just change it because you want to decide to. It's something that you need to have a program or some way to retrain it bit by bit, pushing it in a direction that is more accurate to reality. And we use a very, very expensive high-tech tool to help connect somebody to reality. It's called a wall. You may have one. Seriously, using a wall to focus your attention on one thing at a time. And because you can't focus on more than one thing at a time, because that's what focus is, one thing at a time. You can't focus on your head, your shoulders, and if you've ever taken a golf lesson and had somebody try to
every week, yep.
if you're changing your swing, if somebody tells you 3 things to change, what happens?
It's really hard.
Okay, the best coaches pick the most effective thing to change, focus on one thing, and work on that. And we do the same thing with retraining posture. And this is what CPEPs do to retrain people's posture, to help them find their weakest link in their chain.
And what part can chiropractic adjustments or other parts of a chiropractic treatment play in helping to improve posture?
Because when you have a collapse of the kinetic box, if there is a segment of the spine or a shoulder or a hip, especially lower extremity, a knee or an ankle that is not moving with symmetry, you're going to have that adaptive motion pattern keep on recurring. So the best results with retraining and strengthening posture include restoring motion to links in the kinetic chain that aren't moving and possibly haven't moved for a long time. So you can then direct the exercise to that previously neglected, unused link, and use strong posture exercises to strengthen it to move towards symmetry, beginning with the alignment of using a wall and focusing on one, what's called the posture zone at a time. The first torso pelvis linkage, then head torso linkage, then lower extremity integration, then upper extremity integration.
What do you think about some of the chiropractic strategies that various chiropractic gurus have come up with to passively stretch the ligamentous structure back into a more efficient shape? Things like traction device with a roll here and a weight and, different types of things like that, where you stay for a period of time, maybe with some weight or something like that, to try to re-stretch the passive structures.
Not necessarily evil, but if you only working on the passive structures and you're not working to strengthen it, the moment you load it, if you're adding more stretch to the system, why does something that is overly tight, if you're adding more stretch, why is something that's overly stretched already going to change? Your body is not just things that are tight. There's things that are tight paired with things that are lengthened.
Right.
And if you're not teaching it to actively move towards symmetry, you're not going to be fixing it. Moreover, in a kinetic chain, because your body is a kinetic chain, it's not just your neck. I know a lot of chiros dial into forward head posture, and that's an important thing. But if you're not dealing with the whole body, you're missing a big chunk of what should be addressed to effectively strengthen it. In a kinetic chain, if there is a tight link, there's a tight link and a loose link, and you stretch the whole chain, which link moves first? Think about it for a second.
Yeah, you got to repeat that question for me.
Before we talked about in the spine, if a spinal joint isn't moving,
right,
that means it's tight.
Yeah.
Agree?
Yep.
And so within the entire chain, if one link is tight and one link is loose, and you stretch the entire chain, where does it stretch? Where it's loose or tight?
Yeah, I guess the problem is it's liable to stretch the loose part because that's already moving. So that's one of the reasons why chiropractic adjustments that get in there and mobilize the, tight link, junction is important.
And the thing about chiropractic, as we learned in school back in the day, is you need to find the restricted link of motion, and then you need to take out the tissue slack. If you try to adjust somebody without taking out the tissue slack, what happens is nothing.
Yeah.
Because motion is going to go up and down the chain, and part of what an effective chiropractic adjustment is identifying a site and identifying the direction that it should be moving and tractioning it in that direction to take out the slack in motion. If you're teaching someone how to move differently, you also need to be incorporating their personal awareness of how they've trained their muscular system to move, which means how they trained their neurological system to move and to stabilize that muscular system to make the force move in a different pattern. The problem is the pattern that you've been moving in that feels normal to you. And that's what your posture truly is when you look at it from a more global biomechanic perspective.
And of course, the person who has the forward head posture, they also usually have certain other postural issues, a collapsed thoracic spine, internally rotated shoulders, and you've got to address those concerns as well, right?
Right. And in terms of looking at internally rotated shoulders, is it because someone's got a tight pec or a weak serratus? Or is the problem, or is the problem the rhomboid stabilizing that? But then how does that tie into the psoas? But in that case, you also have a problem with glutes, and piriformis is neglected, and you can't forget what's going on back on top with the upper extremity with coracobrachialis. And this is why, from our point of view, the approach of working on one muscle at a time becomes this, like, you keep on chasing a very long chain, whereas working with global body awareness and motion to address how the global body is balancing, how it's aligning, and how it's moving, by looking and focusing on one posture zone linkage at a time, has incredible leverage from what patients and doctors across the world have told me, to help them make a dramatic difference in how they feel, how they move, very often their sports performance as well if they're athletes, because you want to move accurate to reality. And if you know you're standing tall and straight, that's the beginning point of all your other motions. All motion begins with posture. All motion ends with posture. So that resting position is not just an arbitrary position. It's your perception of where your body is in space and what you're doing to keep it there.
So when you look down at the lumbar pelvic region, what are some of the most common postural flaws? There's a lot of discussion about the fact that you're supposed to keep the proper amount of backwards lumbar curve. Some people train flattening that curve. Other people work on making sure you have enough curve. We have a Pilates program in our office, and there's always a big discussion of neutral and what is neutral, and everybody defines neutral differently. Do you have, do you try to flatten the lumbar spine to recruit the deep abdominal muscles? Do you keep it slightly arched? How much arch? So what do you see as some of the most important postural issues related to the lumbopelvic region?
You're encapsulating the problem that we work to solve, because one of the challenges is that different people playing these games, doing these things, not playing games, but working in therapeutic modalities like this, have different personal histories and experiences. And when you step 2 steps back, it's not about what the perfect lumbar curve is, nor is it about the perfect cervical curve. It's about strengthening the body that you have, because, and even despite the fact that your body might not be perfect. Moreover, if you're like the rest of humanity, it probably never will be. Does that mean that we need to take you out back and shoot you, or that we need to work out how to functionally strengthen the body that you have been given genetically? And that in the way that you've treated it, in taking those consequences of those actions, and actions have consequences, into effect, including things like injuries that have created patterns, and strengthening how that unique system can function in daily life. So to answer your question about lumbar curve, because the big question is it should be more, should be less, should be stabilizing this way, stabilizing that way. I said that the second principle of posture was balance. Your posture is how you balance your body. The first principle of posture, your body's designed to move. If you recall muscle anatomy, a muscle contracts to create motion. Muscles only contract, muscles don't push, muscles are never roped. So if I'm pushing, it's not my muscle pushing, it's a combination of leverage of muscles being combined to create that, but the muscle itself is only shortening. Within a muscle, the shortening happens because of shortening of a muscle fiber. A muscle fiber is an individual cell. a cell will shorten because a nerve impulse hits it, and there is depolarization of the membrane, calcium ions rush in, you have two different fibers, actin and myosin, and there's a little head on one at the other. When the calcium rushes in, it goes like this, and it shortens. Anatomy 101, remember that from school? When an individual muscle fiber contracts, it contracts fully or it doesn't contract. An individual muscle fiber cannot contract halfway. Is that truth to you? Is that truth to everybody that knows anything about biomechanics?
Yeah, no, I completely agree. However, there's certainly a lot of discussion about things that don't quite fit into that paradigm. Like somebody has a lot of tone in their muscles. They're not necessarily, their muscles are not stronger. They're just more toned, or they're harder, or they're ripped.
And that's totally agreed. And the resting muscle tonus will affect appearance. But in terms of gross anatomic function, from Guyton's physiology on down, there's no one that I've ever met that will say that muscle fibers can contract fractionally, that a fiber can contract halfway. It's fully contracted or not at all.
But when it comes to the lumbar spine, isn't it the case that having the curve there, some amount of curve, gives the spine more resilience to be able to handle load? So
yes.
if you look at somebody...
Yes. But the question about curve, though, I think is misplaced, because the point that you're making, the question that it says, which is more stable, the argument is this amount of curve or that amount of curve, which opens the question of which direction do you stabilize in towards neutral, which is where a lot of Joe Pilates stuff came from.
Right.
And if you have Pilates in the office, my feeling is that's where your orientation comes from. And that's why I went through that, because we've had people from every different niche that looks at posture.
No, actually, my orientation comes from weight training. I did the whole bodybuilder powerlifting, weight training, studied that for years and years and years, and even wrote a book called the Back Relief Book. So I've really studied it from that. So I kind of clash with the Pilates instructors a little bit.
And when you talk to them, one way, the model that I'm talking about right now, which is like hardcore science, biology 101, maybe 102. Data that you can't possibly argue with. And my point is, in terms of principles of posture that pretty much are also immutable, your body's designed to move. So the best strategy is not to get really good at stabilizing in this angle or this angle or this angle, but teach people how to move with fluid, accurate control all the way through a functional range, with and without load, and with stabilization in different directions. That's why we use balls in a lot of directions, and for a lot of tools to strengthen people. But the whole motion track of the strong posture exercises uses balls. But that's only after we've started working with, before that, alignment and before that, balance, because the way that you move is dependent upon how you align in order to balance.
Let me ask you the same question.
Working at full range comes first, and then yes, a little bit of curve makes sense. How much curve depends on how your body's genetics are, and that's why feeling your body and working with that makes more sense than an arbitrary, this is perfect and you should be like this.
Okay, let me add another layer or a different way of looking at the same sort of situation. When you're working with a client with a specific type of injury or low back condition. So let's say in the one case, you have somebody who has a confirmed herniated disc in their lumbar spine versus somebody who, say, has bony stenosis, where the bones are actually contracting and where the bones actually are narrowing the space where the nerves and the spinal cord comes out of and is leading to pain. Do you treat those two types of conditions in terms of the posture of the lumbar spine differently? Like, for example, if I have a patient with a herniated disc, we're going to tend to use more of an extension strategy. Usually I'll test the person, and, if they feel more pain or they feel radiating pain when they lean forwards, and, leaning backwards doesn't make them worse, I'll tend to focus on having more of a curve in their lumbar spine, or working on having them do more exercises that involve putting a curve there as opposed to the stenotic person when we work on trying to flatten the lumbar spine?
If you, that's not a bad direction. If you're curious sometime, I might challenge you to try to work on that person a little bit differently and then observe if there's any difference in your outcome. And my anticipation is you'll find that what you're doing passively when you're working with somebody, and passively is both chiropractic, traction, muscle therapy, to unlock and to facilitate the possibility of motion in an arc, is something that, yeah, you do want to work with and with a plan and a direction. But once you've unlocked something, adding additional exercise for a couple of times doing extension is going to be a good stretch for them. And you want them to be able to have that.
Oh, sure. Yeah, we definitely do that.
But having them go in stretching directions that's going towards their pain-free range is the big idea. And using that pain as a diagnostic makes sense, but using the direction of that motion being with stronger posture to take out other compensations up and down the kinetic chain is one of the things that really makes a huge difference. Because otherwise, if it's a low back problem that someone's got a stenotic canal, the stenosis is likely not just in the lumbar spine. Moreover, the symptoms did not just start with the onset of the problem. Their body has been compensating into that for a long time. So there's things going on up and down the chain. So when you look at the person that you are taking care of that's got, for example, marked forward body lean, as you're describing with stenosis, and you look at their head, they've got that same kind of head forward posture with extension. And if you start to teach them how to incorporate that strong head torso position, as well as doing the extension you're doing, you'll find, my anticipation is you'll find the results are better. Because if you look at people doing it right now, most of them, if not all of them, are using some compensation in the top of their kinetic chain. And below the kinetic chain, they're doing more knee bend, and you're saying something, well, you want to keep the knees more, try to keep the knees more straight. And one of the things that we do with the strong posture protocols is by tiering where you want to be focusing the effort, using what we call must versus try cueing, to focus on the attention on this is the important thing right now to gain that control to the maximum of their biomechanic potential. And then sequencing it in direction, you can get a more profound change more systematically, because you're making them focus on the things that they reflexively don't want to move that are weak, because that's where the reflexes are.
Interesting. So what about scoliosis, or this curvature that's some patients, some people have? Is that fit in this posture thing? Is that something you address as well?
I have addressed it. I've seen some cool things with it. I don't, even though some CPAPs are certified posture exercise professionals, that people that use the tools that we talk about and that teach, and the chiropractors largely, they're also trainers and physical therapists and Pilates teachers and Feldenkrais teachers. And one of our CPAPs is a Feldenkrais instructor of other Feldenkrais teachers and yoga people and anyone that looks at biomechanics, trainers. A lot of people in their own practices incorporate strong posture. I lost my train of thought.
Scoliosis.
Oh, scoliosis. Scoliosis, to me, is more of a neurologic problem than a muscular problem. And I know that there's people that retrain in that direction using different kinds of braces that are potentially interesting. I know a lot of the stuff that's been done historically is with surgeries and whatnot, and braces and Harrington rods. I'm less focused on that. Some of the muscular things going for scoliosis, like Scott and others in those directions, have reported decent results, and we've looked at it. But I'm not focused on scoliosis. I'm still focused on overall body posture, because if and when we come out with a scoliosis program, there's other things that I see that are not being effectively incorporated into it that should be and could be. And I think chiropractic should be a good part of it. I personally have had some wild, cool scoliosis cases, but candidly, I've had some that haven't responded as well. Incorporating things like kinesiotape, infrared soft tissue mobilization for that as well is some of the things that can make sense. We have a lot of people that work in those realms, and that's good. I would say if someone having problem with scoliosis, beginning a 7-week strong posture program is an easy, down and dirty way to begin and see what happens. Take a picture and see what happens. And that's why taking a picture is such a valuable way to benchmark rather than getting into how you feel and what do you think. And it's a lot easier than taking x-rays.
Right. Cool. Well, I think you provided us with quite a bit of interesting information, Dr. Weiniger. For patients, people reviewing this or listening to this, as well as practitioners, what's the best way for them to get a hold of you?
2 different questions. If you're a doctor or practitioner, go to posturepractice.com. That is information on CPAP, the Certified Posture Exercise Professional Program. It's got the CPAP logo on it. If you are a member of the general public, I would suggest going to Body Zone for overall information. And for both, I would suggest going to posturemonth.org. May is Posture Month, and we are the instigators, and they call me the chief posture evangelist of posturemonth.org, because posture is important, and having a good awareness of posture begins with being aware, taking a picture. In fact, the campaign for 2018 for this month's posturemonth.org program is ACE Your Posture. ACE stands for awareness, control, and environment. Be posture aware, take a picture. As I said, I like the Posture Zone app, and the app is, that's not it. That's my camera. Basically, use the app to take a picture of somebody. Not in my office, but to take a picture of somebody and to measure where the body is in space, to measure. Can I show it to you? It'll be a good thing to show.
Yeah, sure. Yeah. So this allows somebody to assess somebody else's posture, and can you draw lines on it as well?
Okay, so let's go back. I'm pulling out a picture.
And this is a free app that we can download and put on our phone or our iPad.
It's a free app. Posture Zone is a free app for iPad, iPhone, and Android.
Okay.
And how it's going to work. If you can see this from there.
Okay. Yep.
Okay. I took this picture before the picture. When you take the picture, there's a line on the top and the bottom that you want to rotate it to make it level. And that's a side view. So taking a side view. And I don't know if you can see the bracket. You can move around to bracket the head, the torso, the pelvis over the feet. And you can double tap to make it a bit more precise in the pro version to get a picture of where someone, basically your posture is how you balance your body. So benchmarking, when you're trying to stand tall, it's not just where's your head over your torso, it's where's your head, torso, and pelvis over your feet, because it's about the whole body. And then assessing the picture to benchmark the degrees of deviation of the head over the feet, the torso over the feet, and the pelvis over the feet when you believe you're standing straight. And then you can save that in a folder, and this is my messing around folder, and compare today's picture to prior pictures and see what kind of changes occur. If you're a professional, the free version. If you're a professional, it's a one-time purchase. There's no monthly or anything. I think it's $29. And you can generate reports and PDFs and email them out and communicate to patients and people what their posture looks like. And that's what we do. And that's if you're a member of the public and you've got a question about your posture. If you look in the Posture Zone app, when you get it, there's a button that says find a posture professional. And odds are there's a CPEP near you that does strong posture work and that maybe even be doing free posture pictures for the month of May. And if you would like to have a free posture picture, go to your CPAP and let him let him or her take your posture picture, so you know what you look like when you're trying to stand tall.
Cool. That app looks like something that would be really useful. I'm going to go download it as soon as I get off this call.
Fantastic. If I can give you a hand with it, let me know, Doc.
Thanks, Doc. Really appreciate your time, and we'll talk to you soon. I'll put your information in the show notes on my website.
Also, in terms of ad, I forgot. Live longer. It's a great. I mean, I'm prejudiced, but it's a great beginning to understand more about posture.
That's great. Buy Dr. Weiniger's book, Stand Taller, Live Longer. And until then, we'll see you next time.